Alright, so I show up to the scene. I'm going to perform proper isolation precautions, put on my gloves. I'm going to evaluate the scene. Is it safe? It's safe. I'm going to determine the mechanism of injury and the nature of the illness. It appears this patient has a rib fracture as well as something going on with their ankle. It's one patient, and I don't believe we need further EMS requirement. Patient seems to be stable. I'll double check with vital signs to determine that as well. And we're going to consider stabilization of the spine. However, it doesn't appear that this patient has a spine fracture. It looks just like a rib fracture. So, verbalize the general impression of the patient. Patient appears to just have minimal trauma, not bleeding or hemorrhaging. Responsiveness. Can you go ahead and tell me where you're at? Just where are you at right now? Do you know what year we're in?
2017.
And do you know who the president is?
President Trump.
Alright, so we have a level of consciousness of a GCS of 15. Can you go ahead and move your arm? Patient verbalize movement. Can blinks her eyes, responsive. She's got a GCS of 15 and AO times 4. I'm going to move your arm though. Can you go ahead and tell me what's going on right now? What hurts? Why we're here? Alright, so her chief complaints are her ribs and her ankle. Okay, so I'm going to assess her airway, see if she can breathe, she can talk, she's able to communicate with me. So her airway's padded. I'm not going to insert an adjunct. Breathing, her respirations are a little high. She's at about a 24, but it's normal given the injuries she sustained. She doesn't require any oxygen. I checked her O2 stat and it's still running at about 98%. So I'm not going to initiate oxygen therapy. I'm going to go ahead and manage her injuries. It's not, her rib cage could potentially compromise her breathing, so I'm going to continue to monitor the circulation. I'm going to check her pulse. She's got a little elevated pulse, about 108. The skin appears to be warm, not cool and clammy. I'm going to assess and control the bleeding that she has going on. So if I had something, I would wrap it up, make sure, put some band-aids on it, make sure it's not bleeding. If it continues to bleed, I would put a tourniquet on. And elevate her extremities. We're going to go ahead and make a transport her to the nearest hospital. RMC sounds great. Alright, so are you on any medications? Okay, so etc. I obtain a sample history. My secondary assessment, I'm going to inspect her head. Doesn't look like she has any injuries going on, any lesions. Is this hurt? Alright.